Good morning and welcome to Health Talk, sponsored by Mon General Hospital. This program is designed to provide education on vital health topics to help you take charge of your health. You'll also be introduced to Mon General's committed physicians, allied healthcare professionals, and quality programs and services. And now, here are your Health Talk hosts, Kay Murray and Jim Stallings.
Welcome to our Ask the Expert show, sponsored by Mon General Hospital. We call it Health Talk. Jim Stallings, along with co-host Kay Murray. We meet every Thursday morning with the doctors from Mon General. Good morning, Kay.
Good morning, Jim.
And today's topic, we're going to be talking about the newly renovated and expanded Hazel Ruby McQuain Birth Center. And with us in studio to talk about that this morning, Dr. William Hamilton of Women's Healthcare of Morgantown. Good morning, Dr. Hamilton.
Good morning.
Welcome to the program. Well, it sounds like it's going to be a big time with an open house coming up. So what can you tell us about the renovated and expanded Hazel Ruby McQuain Birth Center?
As our volume of deliveries has increased and almost doubled over the last few years, we really desperately needed more space. 8 LDRPs where patients would labor, deliver, and recover was not enough. And our largest source of patient complaints from the birth center was really the small rooms that we would have to move patients to after they delivered. And our goal was to provide the same quality of service to every patient for every situation. So we're doubling the number of LDRPs from 8 to 16 in a renovation project that actually has gone very quickly. It's only a few short months. Dedication today will be in the facility on the 20th working.
Is the birth rate in Morgantown or the surrounding area going up?
It's increased slightly. Is a little bit of redistribution and really in the region, not just Morgantown. There are people who come to Morgantown for care, and not just an OBGYN, but everything from the whole region.
So more families are choosing Mon General to have their babies.
Yes.
And so Mon General saw a need to expand, and so you're almost doubling in size to accommodate that.
Correct.
And does this mean that you also, obviously doubling in size, you're getting new equipment and a total reinvestment in the whole birth center?
This is kind of a top-to-bottom redo. Yes, new equipment, more equipment, updated equipment. Starting from the simple, when you first come to the new birth center, you'll actually come to the nurse's station. It will be a locked unit, which is a new thing for us. Before, you could pretty much wander in there from anywhere, but you'll have to be buzzed in, not unlike happens in every emergency room and many other places in medical care nowadays. And then once you're in the unit, you pretty much have the rooms will be family oriented. The goal is really that you can do all of your care in the room, that the baby will stay with the mom as long as the baby's well and the mom's in condition to have the baby there. But on the other hand, we also have expanded the nursery. Very often visitors in the old unit would look at the nursery and go, what nursery? The new nursery will actually have 5 bassinets, one's in an isolation room, so if we have a baby that's sick or a baby that is born outside the hospital and transferred in, or for minor procedures like circumcisions that they can be done in the isolation room, and then 4 other dedicated spaces for babies in the nursery, which is something we really have not had in the past.
Really had to change. It did, because when I had my babies, it was a little room. Only the dad was allowed in. They brought the baby in for feedings, took the baby away from you, and it was just in and out all day. But now the baby comes in, stays with mom. You get that bonding right away. Paint a picture of one of these rooms that the mother will go in. I know quite different from what we've had before as far as size and comfort.
Yes, the rooms. Well, the rooms are big enough that you really can have your family there with you. And really the patient drives how many people she wants to have visiting and how many people she wants even at the delivery. Hidden behind the pictures on the wall is the emergency equipment, so that if the mom needs oxygen or the mom needs suction, the kind of things you expect in a hospital, They're there, but they're obscured so that the room really looks like your living room with a hospital bed in it.
That's what I was waiting for you to say. It's not like you're sitting in a room in the hospital. It's like you're in a living room and a nice comfort bedroom where during this time that you're in the hospital, you can have a lot of comfort. You can have your family around you. So important.
It's like staying at a suite at a hotel, right?
Yeah.
Because there's a place for Dad to sleep, too, in there.
Yes.
I understand you also have a dedicated C-section operating room.
This is the big new deal for us. Prior to this time, we've taken the patients for C-sections down to the operating room 2 floors down, and that's always been a level of concern in terms of transporting patients, especially in emergencies. Mm-hmm. So this way there will be a room on labor and delivery for emergency C-sections that will allow us to go directly from the patient's room to the end of the hall. It's actually in the space that was the old nursery, but greatly expanded and brought up to modern code for C-section operating room space with all of the things you have to do that.
Why has it changed this way? Because I always felt when you have a baby, you want your family around you. And at that time, when I had my children, it was like they were so worried about people bringing in things and getting the baby sick. You wasn't supposed to touch the baby. What do we know now that we didn't know 30 years ago?
Well, healthy people are healthy people. We still discourage people who are ill from coming to visit. But in general, it's the same people that are going to come visit at home. And so they need to do some simple things. They need to wash their hands when they get there. And there's some merit in not passing the baby around to 20 different people. But in general, healthy people are healthy people, and babies are very tolerant of.
And they should be smart enough to know if you're not feeling well today, stay away.
Yeah,
absolutely.
Keep your virus at home.
That's right. 304-296-0041 is our telephone number. If you have a question about the new birthing center, we're going to tell you about this open house coming up as well.
Yeah, that open house is today, so don't go away. We'll let you know all about it coming up after the break. You're listening to Health Talk on WAJR.
This is Mon General's Health Talk. If you have a health-related question, call us now at 304-296-0041.
Dr. William Hamilton of Women's Healthcare of Morgantown, board certified in obstetrics and gynecology, and we're talking about the newly renovated and expanded Hazel Ruby McQuain Birth Center. And if you're new to Morgantown and don't know the name Hazel Ruby McQuain, benefactor, and she passed away several years ago, but certainly her legacy is the money that she's made available for great projects such as this birth center at Mon General Hospital. And so the open house is today.
Yes, sir.
So we'll be able to tour the birthing suite, nursing, the whole area?
Yes. There'll be basically like a ribbon cutting at 4 p.m. and then the new space will be open until 7 p.m. with tours so that people can really come in and see it unencumbered without patients and without patient care going on and feel pretty free to roam.
Do we go in that entrance that's on the right side of the building as we're heading up towards the building? There's that lot up on the right. It's kind of the new center, the new annex up there?
Come in the main entrance.
Okay.
And then it's just come in the main entrance and go up the elevators to the 5th floor. You'll come out in a lobby area that's really 30 feet from the entrance to the birth center.
And it's the North Tower, I believe? It's in
the birth center is in the North Tower. It's in the older tower, although that tower has been completely gutted and renovated over the last few years.
As everything has at Mon General, for sure. This is a $6 million project.
Yes.
That's incredible. And what it's going to do for the community in giving us more rooms, of course. What about the stay? That's another thing that's changed a lot. We were talking in the break how long we would stay in the hospital when I had children. It was like a 4-day to 5 days. Now?
Most patients go home in 2 days. Even the C-sections actually go home as early as 2 days.
Really?
A few patients will stay till 3. And part of that is that the anesthesia has changed with C-sections so that the patients are up and moving faster. They don't feel too hot the day after their surgery, but by the second day they're looking around going, I really think I could do this at home. Occasionally people stay till the third day, and they really keep people as long as they need to be there medically. But at the point that they're medically stable and they're ready to go, then there is some merit in the baby staying a little bit. So that's where the 2-day pretty much comes from, is that even if you have your baby, there's not very many people who go home. The day of the drive-by deliveries in the 80s, where there were cartoons where they were handing the baby out the bank teller window.
Yeah, really fast.
Even the insurance companies understand that wasn't good care.
No.
Yeah, that's what I was going to talk about. I remember 10 years ago, the HMOs and the insurance companies were wanting mom to go home with the baby almost the next day after birth. And there was some consternation between medical providers and insurance companies about that length of stay. Sounds like there's been some kind of compromise.
And I'm glad to hear that.
It's actually not even a compromise. Of all of the things that happen legislatively, Congress legislated that insurance companies have to allow you 2 days after a vaginal delivery and 4 days after a C-section.
And so this newly expanded, you said it's almost double the size. We have operating suite. We have labor, delivery, recovery, postpartum. You call that LDRP?
Yes.
And so how much space of the hospital does this all take up? Is it pretty large space?
It's 2/3 of one of the floors in the North Tower. There'll still be a small unit with 14, 15 beds when taking the remainder of that floor. But it's most of the 5th floor in the North Tower.
And most of the time we think of the maternity ward at a hospital where that E-Trade commercial where you can look through the glass and see 20 babies all in there having a good time. That's not like that anymore. There's nothing like that. Being your baby's with you in your suite.
Your baby's in your room. There's really no big window to look into the nursery and see 20 babies in the nursery anymore.
Oh, I would miss that. That was always fun to go and look at all the babies.
I guess you can go to room and knock
it out. The point is, get out.
Yeah, security will probably be talking
right
to
there.
you then.
But security, that is an important point in that you do have a lockdown now. And
security is a huge issue. Everybody's seen reports from other places. There haven't been issues here. They're doing some special things besides the unit being locked down, so it'll be badge access for hospital personnel, and outside personnel will have to be buzzed in. Babies, for a long time now, all have had some sort of security band, either on their ankle or the new ones we're using are on their umbilical cord. Where the old umbilical cord clamp was, it also has a little electronic transmitter in the end of it that tags it to your baby in your room and alerts on the entire 5th floor, plus locks the doors down for the entire 5th floor if that baby is thought by the security system to be in the wrong place at the wrong time. And that can be as simple as the baby going down the hall past an elevator door that comes open. The elevator shuts down and the baby is accounted for.
Wow, now that is something that's not a good thing when you have to worry about that, but it looks like you've taken all steps to make sure that these babies are safe and
safety
mother
and security are key.
Are key, absolutely. You forecast even higher demand for birthing services. How do you forecast something like that?
Oh, there are statistician and demographic people out there. We know that the community is continuing to grow. There's no doubt about that. Just look at the number of new houses and townhouses and condominiums. So with growth comes more babies, of course. Yes, absolutely. That makes sense. And that's the age group that Morgantown is growing in, is the childbearing age group. Not very many of us moving. Yeah, we're just kind of sticking to it, huh?
The open house at the Birth Center, 4 p.m. till 7 p.m. today. Tours will be available. And again, the Birth Center is located on the 5th floor of the hospital's North Tower. Featured guests at the dedication include United States Senator Joe Manchin and hospital spokesperson and former Olympic gymnast Mary Lou Retton. She is a spokesperson for Mon General Hospital. Wonder when she's going to come in and join us on the program, Kay.
Well, I don't know. We'll just have to arrange that.
Yeah, would love
we
to
can
meet,
make that happen.
Love to meet her in person. We'll tell you more about the open house. And by the way, refreshments will be served. You know, I couldn't go through the whole show without mentioning that. So we'll be back in just a moment and let you know all about it and why you should be there today, 4 till 7 at Mon General Hospital.
This is Mon General's Health Talk, providing the information you need to take charge of your health. Call us now with your health-related questions at 304-296-0041.
The Birth Center renovation and expansion at Mon General Hospital, done through a certificate of need approved by the West Virginia Healthcare Authority. Total cost of the project, $5,950,000, 1,600 square feet to 1,800 square feet. That was the expansion. And with an expansion like that, it has to be a larger expansion than that. Maybe I have that wrong.
It's 16,200 square feet to 18,000
square feet.
Yeah.
And so that means more staff, more training?
More staff, more training. The staff will be used a little bit differently because in the past we did all of the C-sections in the operating room. Now the labor and delivery nurses will circulate as OR nurses for C-sections done in our dedicated C-section room in the new birth center. So they not only have had to train for the OR role, but also trained in advanced cardiac life support, because they will also be doing the post-op recovery of the patients who have their C-sections done in the birth center. And we had to expand the staff because there's more rooms, more patients, more space. So we simply had to get bigger on all those levels. The other thing is we're also updating the electronic fetal monitoring program. The hospital has been using Cerner as an electronic health record now for several years. We're going to incorporate the Cerner OB module and really incorporate so that all of the records will all be in the same program. That program, the OB module is incredibly updated. It's going to be something that I can access the fetal heart tracing and what's going on with my patient really from wherever I am, including using my cell phone and my tablet, as well as access it at the hospital.
Who do you think would be most interested in touring the birth center today? Expectant moms and dads, healthcare providers, doctors, family practitioners?
Everybody should come because it's essentially a one-time opportunity to really be completely open and walk through. They do tours on limited basis at other times, but this is the time when there's not patients there, so it's easy to tour. And grandmothers need to come just as well as expectant moms or going to be expectant moms, because a lot of how patients get to medical care nowadays is still by word of mouth. And so everybody should come and see and get their questions answered and feel comfortable that this is a place where they want to come have their baby or want their family members to come.
Will you be leading tours, or are you going to be Senator Manchin's personal escort today?
I'm sure Senator Manchin will have somebody to escort him. I expect to be leading tours.
Yeah, because you probably know the most about what's in there now.
What is the time again?
4 until 7 today.
4 till 7.
And how excited are you? I mean, I know what it's like here at the radio station when we went through a substantial upgrade. It almost renews you when you come to work and get to work with all this great equipment. And you professionally, is it the same way?
This is absolutely exciting. Kay's question earlier about the setting for birth, one of the best descriptions for this setting is it's like having a home delivery but having the hospital wrapped around you so that if you need something more than what you can do in an individual room with you, the nurse, and your provider, there's infinite ability to respond to emergencies.
You can be on a tour today, led by Dr. William Hamilton, and also have some refreshments as well. Sounds like a great new addition to Mon General Hospital. I'm glad we were able to talk about it today on the program. Thank you so much.
Thank you.
This is Health Talk on WAJR every Thursday morning, 8:35 till 9.